If outlined in your procedures, assist in the setup of the emergency room bay in preparation for the patient after receiving your assignment from the charge nurse. This may include transferring all equipment that may not be needed for this incident to a designated clean area, and covering all cupboards and equipment that cannot be removed with sheets of plastic. Ensuring that all supplies that are needed for this incident are stocked and prepared according to your procedures. Posting the necessary signage in the proper predetermined areas. Placing colored, striped, or radiation tape on the floor to outline and separate the dirty areas from the clean. And placing "Do Not Enter" or other warning signs around the perimeter of dirty areas. Don full radiation protective clothing following your procedures. More information about proper donning can be found in the donning video. Take the prepared gurney out to the patient receiving area if it has not already been done and position yourself along the side. Once the ambulance arrives, assist with the transfer of the patient from the potentially contaminated ambulance gurney to the clean ER gurney in the patient receiving area. Wrap the patient in one of the sheets from the prepared gurney to contain any possible radioactive contamination and assist with their transfer into the emergency room. If the patient is assumed or known to be contaminated, help remove their clothing by carefully cutting and rolling away from the patient to keep contamination contained within the rolled clothing. Do not cut and rip the clothing, as this may cause the radioactive material to become airborne and possibly inhaled by either the patient or the emergency staff. To maintain good contamination control and prevent the spread of radioactive material, remember that every time you touch a patient that is known or assumed to be contaminated, either have your gloves checked by the radiation safety personnel or change out your gloves before touching any equipment or the patient again. During patient care, life-threatening injuries or trauma situations take priority over cleaning the radioactive contamination that may be found on patients. If the patient isn't critical or doesn't have life-threatening injuries, it's left up to the discretion of the physician as to which actions take priority. Communicate patient information, vital signs, and medications administered to the recorder or scribe in the clean area. Enlist the help of the primary RN with the decontamination of the patient whenever necessary. If radioactive material is found on intact skin, first attempt to decon using a wet wipe. Start by cleaning in a circular motion around the contaminated area from the outside towards the inside. Cleaning intact skin in this manner helps to prevent the spread of contamination to surrounding areas. Re-monitor the area once this is completed to determine if contamination has been cleaned to the acceptable levels outlined in your procedures. If contamination is still present, place an absorbent pad under the contaminated area and irrigate with water or saline. Wipe the area dry using the same outside-in motion and re-monitor to ensure that the skin has been decontaminated to acceptable levels. Repeat this process as necessary. If radioactive material is found in an open wound, place an absorbent pad under the contaminated area and irrigate with saline solution. Gentle dry the area using an inside-out motion. Cleaning open wounds in this manner avoids working the contamination deeper into the wound. Re-monitor to ensure the wound has been decontaminated to acceptable levels. Repeat this process as necessary. For the eyes, rinse with water. The stream should go in the nose to temple direction, away from the medial canthus. For the ears, check for contamination using a swab. If contaminated, rinse gently with small amounts of water and suction frequently. For the nose, check for contamination using a swab. If contaminated, rinse as needed. For the mouth, check for contamination using a swab. If contaminated, turn the patient's head to the side or down as patient's condition permits. Rinse gently with small amounts of water, suctioning frequently. As much as possible, prevent water from entering the stomach. If necessary, you can insert a nasogastric tube into the stomach, then suction and monitor the contents. If they are contaminated, lavage with small amounts of normal saline until contents are clear of contamination. For the hair, thoroughly shampoo with mild soap, then monitor and repeat as needed. As patient samples are taken, label tubes with the patient's information and pass them from the dirty area to staff in the clean area. When passing items across from the dirty side to the clean side, bring the item to the boundary and place into plastic bag that is being held open on the clean side. Ensure that as you are doing this, your hands never cross the boundary into the clean side. Assist with the transfer of the patient out of the dirty area and into the clean area. Doff your personal protective equipment by following your procedures. More information about doffing can be found in the doffing video. Then give the patient report to the receiving entity if the patient is being admitted or transferred.